Good morning, everyone. I'd like to begin by acknowledging that we are gathered here today on the traditional territory of Treaty 6 and to recognize the Métis people of Alberta who share a very deep connection with this land. Over the last 2 years, Albertans have seen the consequences of the extreme pressures on our healthcare system. Today, Albertans are waiting longer for care, whether that's waiting in the hospital ER, waiting for the ambulance to arrive, or waiting for a family doctor to move to their community. Our hospitals are both over capacity and understaffed, and it's patients who are suffering. There are tens of thousands of Albertans whose surgeries were delayed during COVID because this UCP government failed to show leadership. 4 years of UCP chaos, inaction, and incompetence, and now Danielle Smith wants Albertans to believe that the answer to these challenges in public health care is more privatized, for-profit delivery of that care. It's not. Let's look at what's happening in Ontario. Just last week, Premier Doug Ford announced, after zero consultation, the biggest expansion to private healthcare in Canada's history. A reckless plan to outsource major surgeries to private for-profit clinics. A plan that even Ontario's Auditor General warned will mean, quote, no provincial oversight to protect patients from being misled about their right to receive the standard publicly funded surgery without having to pay any fees out of pocket, end quote. What's worse, he warned that these clinics work to upsell patients on care plans not covered by health insurance. That is wrong. In Manitoba, the Conservative government is promising more private surgical clinics, while in Saskatchewan, where these clinics were put in place just a few years ago, wait times have never been longer. This is the first step toward an Americanization of our healthcare system, and we cannot allow this broken system to grow in Alberta. This kind of plan, if implemented, will have a significant impact on frontline workers and patients. We know from other jurisdictions that every time there's an expansion of privately delivered health care, it creates chaos. The costs of care go up, the quality of care goes down. And nurses and frontline healthcare workers leave the public system to work in private facilities. This is all part of this UCP government's plan to force Albertans to pay out of pocket for basic healthcare services. You only have to look at Danielle Smith's own video, her own testimonies, to see where she wants to take this province. She has stated explicitly that her plan will ensure patients get used to getting medical bills at the bedside. Listen, this is an important time in our history. COVID has left healthcare in this country in jeopardy, and opportunistic conservatives across this country are using these pressures as an excuse to expand private participation in public health care. They say this is an easy fix, but it will actually only make the situation worse. It will cause more chaos and more instability. It will pull staff out of public health care. Care will be more costly and less coordinated. Ultimately, it could leave patients paying out of pocket. So I'm here today to send a message to Albertans and to Canadians. Alberta's NDP will not stand idly by and witness the death of Medicare in this country or in this province. We live in the most prosperous province in Canada. And right now, we have a responsibility to show Canadians that we can lead on reforming and strengthening the public healthcare system, care that can be the envy of the world. This is the approach we will take should Albertans elect an NDP government. We will invest in public health care where and when Albertans need it. In the coming weeks, we will present a plan for family medicine to ensure you have access to a family doctor. And we will improve staffing across the entire system, the largest healthcare recruitment effort ever seen. And while others threaten to burn out Canada's health workers in a broken system, Alberta will rebuild Medicare for the future. We will lead Canada in a different direction, one where everyone, regardless of their bank account, has equal access to high-quality care covered by universal health insurance. We cannot afford 4 more years of chaotic, incompetent, and cruel government and leadership in healthcare under the UCP. It is time for a stable, caring, competent government. it's time for an Alberta NDP government. So thank you. I'm happy to take any questions you might have.
And we'll start with questions in the room.
Yeah, thanks very much, Catherine Gurkowski, Alberta Today. So I believe it's under the Health Facilities Act for years, in fact, before you were in government, both physicians in both hospitals and these chartered surgical facilities are allowed to charge for certain services or products that are beyond the basic. Like maybe there's a lens that you get for cataract surgery that's covered no matter what, but if you want a special lens, you can pay more for it. So what's wrong if everybody has the opportunity to access that basic care? What's wrong with charging people if they want, you know, the Cadillac of whatever medical device or service?
Well, I think that actually the scope and the area within which that kind of sort of dual provision of services is allowed is fairly narrow. And of course, the reason there's a problem with that is because if the healthcare is being delivered in a private facility, there's no consumer protection, there's no patient protection for how and when those services are offered or sold to patients. And so patients are in a very vulnerable position. And you also run into a situation where perhaps these facilities won't provide the publicly funded option and instead will encourage their patients to demand only the privately funded one. So overall, it leads to a growing disintegration, a growing siloization of the public healthcare system overall, and you have less coordination and competing for-profit demands that undermine efficiency of delivery, and so it costs more, and the consistency of the care goes down, and ultimately the quality of the care goes down.
So is the answer to bring more of these services and devices under the publicly insured system? Is the answer more oversight of these charter surgical facilities? Like what's the answer to this?
The first start is to not expand private delivery. That is the first step. And then slowly, as finances and time allows, you offer up and move to increase the level of public delivery. During COVID, we learned starkly, in tragic ways, the different healthcare outcomes depending on the nature of the delivery of the publicly funded healthcare. So even though it's all publicly funded, we learned that privately delivered long-term care versus publicly delivered long-term care resulted in more deaths, more illnesses as a result of COVID. That was a clear demonstration of what people have been saying over and over and over again, that private delivery often undermines the quality of care. Why? Because there is a need for a profit margin to be secured that does not exist within the public system. And so that's one thing. Then the other thing that happens, depending on the place that the care is being offered, is that coordination becomes more difficult. And as a result of that, costs go up and efficiency goes down and care is compromised.
We'll go to questions on the phone. Just a reminder to press *9 if you're on the phone. Use the raise hand function if you're joining us via Zoom. If you could say your name and your outlet at the top. Go to our first caller. Go ahead, Dean.
Can you hear me?
Yep.
Yeah. Okay, good. Off topic, I wanted to ask you about the Preston Manning Committee. If the NDP wins government in May, are you going to continue with this committee? And if so, and also if you don't, would you still pay out Preston Manning?
Well, let me just say, there's upwards of 1 million Albertans who are deserving, who cannot access $100 a month, yet Preston Manning is getting paid roughly $50,000 a month to promote misinformation and untruths. So yeah, Dean, we'll be taking a hard look at that. And to put a fine point on it, we will not continue that panel, and we will do everything we can to negate what is an outrageously unjustified level of compensation.
Any follow-up, Dean?
Sorry, can you just elaborate then? What is your main concern with Preston Manning and the panel and the terms of reference and that sort of thing?
Well, I mean, well, first of all, to start, there is no justification for the level of pay that Preston Manning is receiving, so that's the first thing. Second thing is that he brings no objectivity, no scientific expertise to the job of assessing and evaluating this issue. And thirdly, his previously stated opinions are incredibly biased and, quite frankly, not supported by peer-reviewed science. So this is an exceptionally expensive throw to Danielle Smith's extreme base at the expense of Alberta taxpayers at a time when folks need her to be focused on their cost of living and their healthcare system in need of real solutions, not pretend ones.
Do another pass for questions. Star 9 if you're joining us on the phone. Raise hand function if you're joining us via Zoom. And that's all for today. Thank you.
Thank you for watching, and to learn more, check out albertasfuture.ca.